Yeah, so after this, we're going to watch something called a Carotid Endarterectomy. If you like pimple popping sort of stuff, this is like the ultimate pimple pop. It's badass. Super cool. And remarkably easy to find on YouTube, by the way. You saw brain surgery on YouTube? Yeah, all that shit's up, man. You can find pretty much anything. My kid and I were watching a heart surgery. There's like a 40-minute video of a heart surgery, and I was explaining to him what happens. So my kid he turns 5 on Tuesday, by the way, so he's like, oh, there's somebody with their chest cut open, that's cool. I'm warping my child. He'll be even more fucked up than I am, if you can imagine that. Alright, y'all ready for this? There we go. Alright, music, you're getting muted. Oh, this is Angels We Have Heard on High? This is awesome! Very Metal Christmas? I didn't even play that on purpose. Holy shit. Okay. Well, we're gonna play these in order. I'm gonna stop shuffling after this. That's badass. Alright. Let's go.
Mastoid muscle has been separated
So this is incision.
from the surrounding tissue.
God, I'm starting early. Hell yeah, I
It can
do.
be reflected
He's gonna be weird.
laterally to reveal the internal jugular vein.
So the internal jugular vein is the vein that you use for central lines. So if you put a big IV in somebody's neck, that's the vein you
It
use.
can be reflected laterally to reveal the internal jugular
So that's
vein.
it, right there. This is the IJ. It's a big ass vein. In most people, it's probably about a centimeter wide-ish. Maybe a little less.
The
Kinda
facial
chunky.
vein,
It's a
branching
chunky.
off the internal
Chunky
jugular
dude.
vein, can often be used as a landmark for the common carotid artery bifurcation.
Yes, it can.
Can be ligated with silk ties. Other small tributary branches off the internal jugular vein can also be ligated in order to facilitate the access to the carotid artery.
Okay, that's great. Here, I'm going to show you an ultrasound of what this looks like so you can actually get a decent view, like decent mental picture of what they're digging for. Here's the IJ. Right, so as I said, probably about a centimeter. Each of these dots is a centimeter. Right, you can see the 1, 2, 3. So 1 and 2 centimeter-ish. So this is on top of this. And the way you can, this is the carotid. This is the internal carotid. Or common carotid. Sorry, it's common carotid. The way you can tell which is one, this is bigger and on top. But people's anatomy is weird and it's not always there. And they're not always in this orientation, right? I've seen 3 people in my career who did not have an IJ. They just didn't have one. You can squish this. Like, basically, if you push down on it, this collapses, this doesn't, because our arteries are high-pressure systems and veins are not. So what they're doing in this is they're dissecting down this part, right? So they're cutting through this, and they're kind of going to move this bad boy off to the side so they can actually work on this.
Which sits directly posterior to the internal jugular vein. Once the internal jugular vein has been completely mobilized, it can be reflected laterally to reveal the carotid artery.
Boom.
As you maneuver
Boom.
around these vessels,
That's a slow heart rate.
extensive manipulation of the carotid sinus should be avoided.
Yeah, so what they're going to talk about here is your carotid artery has what they call baroreceptors in it, which modulate your blood pressure. And so if you smash this, your body thinks, and it's linked to your vagus nerve. So if you smash that, your body thinks that your blood pressure is super high, and it tries to compensate with like vasodilation and dropping your heart rate. So you can actually make somebody's heart rate go to 0 by smushing the carotid sinus. And I've seen that a few times. It's really scary. But and you can ablate that by injecting this with lidocaine. Like if you just numb it, if you anesthetize it, it won't do that.
In some patients, pressure on the carotid sinus can cause bradycardia.
Can you smash it from outside your body? Yes, you can. In fact, if that is a potential treatment for that is an awesome question, by the way, and you totally can do that. That is a treatment for supraventricular tachycardia, actually. So people who have like palpitations and racing heartbeats, you can do carotid massage. Most of the time, you don't recommend that because if you have any plaquing in here and you smash your carotid to that degree, Can I show you? Yeah. Basically, you just feel your carotid. Mine is there. You kind of go up a little bit because the carotid sinus is like right where it bifurcates into the internal and external carotid. So you go up and just press it.
A 1% lidocaine solution can be injected near the carotid sinus
Holy shit, it's like I know what I'm talking about. Oh my
to
god.
help mitigate the side effects that may occur from the dissection of these vessels. Next, carefully
Is that the thing you check to see if someone is alive? Yes. Yes, it is. It's one of the things. It's just a gigantic pulse, and like your body preferentially will preserve blood flow to your brain for obvious reasons. I learned something in residency. Do you believe that shit?
plaque will extend
There we go.
into the external carotid artery. This
Yeah.
can often be left untouched. Stenosis located here is
So
less
can you guys tell
clinically
what's going on? So this stuff right here is the artery. Right? This is the actual like wall of the artery. This shit in here is like cholesterol plaque. So yeah, what they're doing basically here is they are peeling back the wall of the aorta. Or sorry, not the aorta, the wall of the carotid. And getting all this shit out of here. So the problem with plaquing in your artery is that it's not just simple cholesterol buildup. You can't just, you know, flush this out. It actually has cellular material in it. Like cells grow over this stuff and like mix with it as it deposits. So it actually kind of like grows into the wall of your artery, kinda. So you actually have to go in and like peel this out and take it out. Obviously, there's a lot of blood flow that goes through your carotid arteries, right? So there are lots of ways around this. Now it's time to look at the Circle of Willis. This is the like internal circulation of your brain. So like if you block off this, which is what you're doing, then you still have blood flow to the rest of your brain through all this stuff. The one that I think is the most badass fucking cool thing, you can do this surgery awake. You can have the patient awake for this surgery. You do that with a nerve block, which the anesthesiologist does, which is super cool. Yeah, right? Isn't that awesome? And that's actually, yeah, it is fucking metal. You slice open somebody's neck and like pull a giant booger out of an artery while they're awake. And it's totally cool. And you just ask the patient to like squeeze like a rubber ducky or something. Like you put it in the hand opposite the side that they're working on and just have them like squeeze it every now and then, or you just like ask them a question. Here you go. You ready for the money shot? This is so fucking satisfying. Every time I can, I watch this. Look at this.
is visible and carefully cut the atheroma. Then the plaque can be cut as
Take
it
it out.
enters the external carotid artery. Remove the atheroma from the lumen.
Oh man, was that as good for you as it was for me? Oh, so good. Scrubs are a dangerous thing to be wearing sometimes, man. Oh. And anyway, folks, I'm Milkman Al. Please don't forget to like, follow, and if you're on YouTube, subscribe, please, please. All right, y'all. Have a good night. Take it easy.